Peace, family. You tapped into the DOA TBM. Don't forget to like, share, and subscribe for more content and updates. This one's so groovy, baby. So, peace, family. We're back with another special guest this week, and this time it's actually two special guests. We've got Randy Big Swoll Thornton and Dr. Julia Worrall. What's good?
Nurse.
Nurse Julia.
Thank God for editing.
Nice. Yeah, they won't know what we meant, but it'll be good. Yeah, how you guys doing out there in the States, man?
We're doing okay. Well, I'm in the States. She's in Canada.
Okay.
And
Good.
I'm sorry, go ahead.
Canada.
It's good. Actually, we're having some beautiful weather, and everybody's just trying to soak up every last bit of it.
Okay. Well, down here in New Orleans, it's hot as hell. I mean, it's super hot. I mean, nobody can go because in Louisiana, COVID is real bad in Louisiana. So they shut a lot of, right now they got hospitals that are not even doing surgeries anymore. That's all they're doing is COVID patients. Wow. And we have a big uprise in young people, children. At Children's Hospital doesn't take all patients, but they're so full of COVID, but, we taking it easy. For me, for having a heart disease, I have to be very careful. And, I can't be around people and stuff like that. And you know me, I'm a people person. But, I just want to say, thank you for this opportunity to share this very important information with the hip hop community. This stories they need to be told and learned.
Yeah, no, definitely. And I think, when we speak, we always definitely chime in on healthcare just within hip hop and just within the world and stuff and how important it is. So I'm definitely appreciative to have you back on the platform and this time bringing a super special guest who we'd like to hear some more about as well. So maybe we get a bit of an introduction of some of your work, Julia.
Sure. So I've been a nurse for around 25 years, and my background is in critical care, in the emergency department, and ICU. And I switched within this last 10 years to starting to focus more on the role that sleep plays, because believe it or not, healthcare providers don't really get much education on sleep, if any, like maybe 3 hours in your entire program. So think about that. If 1/3 of your life, 8 hours of the day you spend sleeping, and you have health issues, and you go to the doctor, and they're only getting 2/3 of the story, how can they possibly create a treatment plan for you that's going to be effective? Because you could spend your day doing the best that you can, making the best choices for food, for exercise, for lifestyle, for stress. But I started to realize what would happen if people close their eyes and then for the next 8 hours, their brain is sabotaging them because they're not getting the proper sleep. And so I really started to focus on that, and I teach courses. We just launched a magazine called Best Sleep Magazine, and it will be dedicated to sleep. Our next issue is going to have Randy on the cover of it, because he has been probably my biggest fan out there. And he has on his own done so much research and put out so much information for people if they would just take a minute to listen and absorb it, right? Yeah, so that's how we got connected. And I want to say thank you so much for allowing me to be on your program today.
Hey, no problem. And we definitely appreciative to have you. Your work sounds well researched and well documented and stuff as well. I think when we think about sleep, it's definitely something that's ultimately important. Getting enough rest and stuff, being able to function. A lot of us lead such busy lives and stuff nowadays. And one thing about Randy, he's spent many years in the entertainment business, and he's had the experience and opportunity to be around artists, entertainers, and sort of see the correlation between how the functionality of them sleeping and socially and stuff like that, and just adverse effects it can have. So I guess, sort of looking at sleep, I know you said we sleep on average, a third of our lives and stuff away. Would you say to start with that's getting too much sleep? Because sometimes we hear a lot of debate where some people say that's too much sleep to get, and then sometimes people say it's not enough. So what would you say on that?
So, okay, here's how I will explain sleep. I'm going to liken it to eating, because that's something we're all accustomed to, and it happens during the daytime. Okay, so what if you were to tell me that you have a unique way of eating and it works for you? Okay, well, okay, we all have to eat the same way. We have to put the food in our mouth. We have to chew the food. Mm-hmm. We have to swallow the food. Mm-hmm. It goes in our stomach, and the acid has to churn it. It has to push it into our intestine, mm-hmm. into our large intestine. And then we have to evacuate that. Mm-hmm. You could eat and eat and eat and eat, but if you didn't evacuate or eliminate it, you would feel disgusting. You'd feel sick. You might even start throwing up, right? When you look at sleep, there is a very set, specific occurrences that take place during sleep. Mm. And they all have to culminate with the elimination of all of the neurological waste from our brain. We have to be able to eliminate. If you only sleep part of the night, it's almost like eating, and then you wake up early. It's like you never got to eliminate. So maybe I will take a moment to show you what I'm talking about, and then when you ask your questions, I can refer to it. Would that be okay?
Yeah, that sounds great. So,
okay,
we'll give you a moment to set that.
Yeah, I'm just gonna move this over. And let me turn this light on, because I think most people. Let's see here. Now you tell me, can you see that whiteboard?
Yeah.
You can see it okay?
Yeah, I can see it. And I got glasses on, so...
I'm going to turn on one more light. Hang on.
Yeah, you can read it, Randy. I got my glasses on, so...
Yeah, I can read it.
Okay.
I can see it.
Okay, so I'm just going to describe what happens during sleep, because a lot of people think if their eyes are closed, they were sleeping. Mm-hmm. All right? So you start in stage 1, where you start to feel drowsy. After lunch, me talking to you, hearing the sound of my voice, you might start to just feel that warm, fuzzy feeling. That's stage 1 sleep. That can happen to people when they're driving down the road and they're tired, right? As soon as you start to feel where your eyes are like, oh, you start to feel mushy. That's stage 1 sleep. It takes about 0 to 10 minutes to go from awake into stage 1. Mm-hmm. So when we're looking at how long it takes you to fall asleep, it actually should take you 7 minutes.
Wow.
Okay? 7 minutes.
Okay.
When people say, I'm asleep before my head hits the pillow, they're so proud of themselves because they think that they're a great sleeper. Mm-hmm. But that's actually a sign that you are sleep deprived. You may be having lots of hours of sleep, but it doesn't mean you've been having restorative sleep. So somebody who falls asleep too quick, I can sleep anywhere, anytime, I'm great sleep. No, you actually have a severe problem. The other opposite side of that is if they take way too long to fall asleep, then that could be a sign their nervous system is not calming down enough for them to go to sleep. So that's called insomnia, and that's a problem, okay? 8 to 10 minutes. Then you go into stage 2, and that lasts about 10 to 25 minutes. And that's the period of sleep where your eyes are closed, you feel so relaxed. And if somebody walked into the room, you would be aware of it, okay? But you'd be just hoping they leave. Like, just get out of here. Don't talk to me. And if they talk to you, they could arouse you easily. But you're in that place where you're kind of committing to going to sleep, right? So you get irritable. Get out! I'm trying to sleep. 10 to 25 minutes. Then you sink deeper, okay, into the stage 3 sleep or slow wave sleep. That is where now you disengage from your environment. So somebody could be walking in the room. They could be talking. You wouldn't hear them. You wouldn't connect. Your brain has shut down to the outside world. And it's during this slow wave or this deep sleep where your brain actually, the activity in your brain really starts to go down. And what we start to see are these nice, deep waves of activity in our brain. Okay? Not much blood flow, not much happening in the brain during that time, because it's during this slow wave or this deep sleep that our body is getting repaired. All right. So that's where your muscles are getting repaired. You're getting growth hormone. Your bone is repaired. So the first 4 hours, first half of your sleep is dedicated to repairing your body.
Wow.
Wow.
All right. Within the first 90 minutes, you will get a spike into REM. And REM is your rapid eye movement. REM, we call it, there's a flip-flop switch, okay? It's not something like the 1, 2, 3 that you ease into. It's something that happens, turns on, and then turns off. Mm-hmm. But it will only turn on and turn off if you have enough of the neurotransmitters to make it happen. Mm-hmm. So histamine, think about, we always associate histamine with allergies. Mm-hmm. Think of how many people take
antihistamines for their, especially this time of year.
Yes. And think about how many people, they can't sleep, so they'll take a Tylenol PM, an Advil PM, a Benadryl, all right? That's an antihistamine. So basically, you knock that out, you're not going to go into REM. If you don't have enough vitamin D, you don't have...
with that slight connection.
Is interested in muscles and skeletal muscle, etc.
Okay.
All right. So slow wave, slow wave, slow wave, your deep sleep. And then at around the 4-hour mark, we start seeing an increase in REM. And as the night progresses, we get more and more REM. Mm-hmm. The last period of REM can last around an hour.
Oh.
So now when we start talking about how many hours of sleep should we get?
Mm-hmm.
Okay.
Well, let's ask you, do you want to have your body functioning, but your brain offline? Mm-hmm. Because if you don't get REM is where our memories are formed. So whatever you learned goes from your short-term memory and gets put into your long-term memory. Mm-hmm. Okay. Emotions, trauma. You had an upset, with a fight with somebody that you care about, and your heart's broken. If you don't get REM, you're going to wake up the next day and still be chewing on that.
And it's still
right.
Wow.
Yeah.
Right?
Yeah.
Still chewing on that. The other thing we have to consider is the hormones that we need. So, for example, for men, for sexual dysfunction, erectile dysfunction, testosterone, that's released in REM. The erections occur during that time. The rest of your muscles are all paralyzed, but that's where it's repaired. So we see a lot of men who don't sleep enough, and sexually speaking, they are like a decade older, right? They're functioning like somebody a decade older. And we see all sorts of clinics where they're providing testosterone for men, a patch, an injection, instead of looking at their sleep. How much REM are you getting?
Wow.
Okay. The other thing is that our first responders, our police officers, our military, any of those people that are in these high stress jobs creates a hypervigilance and might prevent them from getting into the deep sleep in the REM. And that's why we see so much mental health issues with these folks, right?
Okay.
So if somebody was going to say to you, I get by just fine on 4 hours of sleep. I don't need it, man. I don't need it, okay. But what you're going to know when you deal with that person is emotionally, they are not going to be stable. And if that continues, they will end up with dementia, Alzheimer's, Parkinson's.
Wow.
They will end up with neurological degenerative disorders.
And you know what? A lot of very rich rappers, people in the entertainment business, tell people that all the time. Oh, I only work with 4 hours of sleep. Yep. Even people in the stock market. What you just said is so true, because I hear it all the time. I only need 3 hours of sleep. I only need 4 hours of sleep. Like my ex-boss I used to work for, he'll be up for 2-3 days and be the meanest son of a bitch you ever been around. Yeah.
Right. So you're gonna, whatever you sacrifice on your sleep, you're gonna pay for.
Right.
During your life.
In a number of sense. I think, it's amazing. And like Randy was just saying, so many different elements of business and stuff. And I guess just even in modern society encourages somewhat for, for you to get the work done. If you can get it done on a few hours, and, if you can be back up and get back to it. And, I mean, I'm still kind of mind blown by all the stuff you just broke down. We had a bit of slight connection issues in between it, but I'm sure we did get all of it, and I was enjoying just how you broke down the stuff with the REM as well, and because that sort of led me to think of just the different stages of the mind and stuff as well. We've got the conscious mind and the unconscious. So are people actually slipping into what stage of the mind are they at when they're sleeping? Because you made a great point saying, we can go to sleep and wake up with the same sort of problems and mental dispositions without having processed them properly, and having that lead on to other mental issues and stuff like that too, which I think is super important. We see so many cases of, young people with high cases of mental health and stuff now. A lot of people coming from stressful environments and situations and stuff, and not having the right, I think, information and tools to process it. And something that sounds, I don't want to say as small as sleep, could be something to solve it. But let me ask you this, in your professional opinion, can it be sort of remedied or rectified, or is it a thing like if you upset, like most things, if you upset the balance too much, then it's sort of just one-sided and it will go more degenerative?
Great question. So when we're looking at memory that has been destroyed because of poor sleep, what we find is that by improving sleep, whatever the problem is, we are able to improve the memory. There are certain parts of the brain that don't come back fully. So you may be able to restore it 80%. Okay, when we're talking about the white matter of the brain and the gray matter of the brain and the impact on those. Some of them replenish well and some of it does not. But we see huge effect. When it comes to mental health issues, so the inability, when you're looking at a sleep test, the inability to switch between non-REM and REM, between that deep sleep and the REM, is a sign of mental illness. And if left to progress, it could become depression, anxiety, bipolar, schizophrenia. We do see improvements when we improve the sleep. Think about this. There is a therapy that they use for people who have PTSD, who are really struggling. It's called EMDR. Have you heard of that, with the eye movement desensitization? Yes. So they will get the person to move their eyes back and forth, while they're processing a traumatic memory, to access the part of the brain that holds that memory. They're trying to replicate what happens during REM. Okay, so they know this is what happens. They're trying to do it during the daytime. There are lots of things that we can do to improve that, but we have to first be able to analyze the sleep and know where it's broken before we can help the person. Okay. We do know that people experience sleep disturbance a full 6 months before they ever complain of being depressed or anxious. If you looked at the sleep was broken first. We're looking at it backwards, and we are medicating people with substances for their depression or for their anxiety that actually disrupt their sleep architecture. What we just described, it actually disrupts it. So now you're taking a medication for your depression, but it's not going to allow you to get into REM. And REM is where your emotions and your mood are fixed. But now this medication is not going to let you get into that place, and it's going to try to artificially manage those symptoms. So you see how we're kind of on this treadmill that got away from us. It got away from us because we didn't fully understand the role of sleep. It's only been the last 15 years that we have started to have so much knowledge about sleep. So,
would you say it's the same problem that Michael Jackson and Prince had?
Michael Jackson literally died of a sleep disorder. Sleep killed him. Okay. If you are not able to have sleep, so they did a study on rats, and after 11 days without sleep, the rats died. Similarly, if you deprived them of REM, they died within, it was around 18 months. Okay. So we're looking at now a man who did not have REM sleep for, what did they say, 60 weeks? Something like that. Like, he would have died shortly if it hadn't been an overdose of that medication. Okay. The other thing, when you look at Michael Jackson's case, his sleep was broken from childhood.
Right. Yeah.
His dad would come home from work, keep the kids up all night so they could practice. Then they'd have to get up to go to school. They would grab sleep here and there. So the sleep was broken. Then they start to entertain, and they're out and they're performing. When do they perform? When do artists perform? In the evening, all night. And you're revved up, and you've got all that adrenaline going through your body. And then what? You're supposed to go to sleep? No, you have to cool down from that. So their whole circadian rhythm starts to get shifted. Then they start traveling back and forth across time zones, right? A further insult to their sleep. And he had all sorts of surgery done on his nose. If your nose is not functioning, your nose, as you breathe through your nose, it regulates the waves in your brain. Okay? If you're not nasal breathing, your brain waves are going to be all over the place. Well, they destroyed his nose with those surgeries. And the doctor reported when he came into the room, he was surprised because Michael Jackson normally snored really loud. I don't know if you noticed that point. He normally snored and he was quiet, and that's what made him think there was something wrong. Now, why did that doctor not realize that if Michael Jackson was snoring, he had sleep apnea and should have had a CPAP on? Right? That's why he was having trouble sleeping, because he wasn't breathing half the time. So yes, I mean, Michael Jackson is a extreme case of sleep gone wrong in an entertainer. That is for sure.
What do you say to somebody like a Dennis Rodman who doesn't sleep at all? I know Dennis Rodman personally. We wrestled together in WCW. This guy will party. Come, meet me at the gym the next day. Train and work out, no sleep, none.
Okay, so I'm gonna say something. Dennis Rodman is a mouth breather. He's a mouth breather, and I'm not saying that disrespectfully. If you look at the structure of his face, okay, when you start to get the bottom lip gets way juicier than the top lip, and it has a little bit of a slag. Do you know what I'm talking about?
Right.
I'm not describing it really well.
Okay, yeah.
Okay, but the muscles aren't toned so that the lips are sealed. He's walking around half the time, you can see his teeth. His mouth is open.
Okay.
When you breathe through your mouth, you're bypassing the brain's whole system for detecting your safety. All right, your brain needs you to breathe through your nose so it can examine the quality of the air, it can adjust your respiratory rate, etc. When you breathe through your mouth, you bypass that, you overbreathe. You breathe too much and you create an acidic environment, you create a stressful environment. Now, your sympathetic system of your nervous system, your fight or flight, is always upregulated. So those are the people who are just, always edgy, always ready. They are living on pure adrenaline. It is having an effect. So when we're working with people, first thing we're doing is we're getting them to seal those lips, open up the nose. It could have been with wrestling. He could have gotten an elbow to the nose. He could have had any type of injury to the nose. That may make it difficult for him to breathe through his nose. But we are to breathe through our nose and eat through our mouth. When we upset that, we change our physiology. Does that make sense?
Yes.
Yeah. Oh yeah,
Yeah.
It does that. That's amazing. I never thought of that, but just some of the stuff that you were uncovering and stuff, it definitely makes sense. It's making me think just on the spot as you were describing it and stuff. Yeah, Randy, did you have any other questions? I know you had some that was written down.
Okay, this is something I want both of y'all to talk about, because I was with a very famous rapper yesterday. I don't want to say his name, from New Orleans. He came to my house yesterday, and he came to check on me because of my condition. And he had over $200,000 worth of jewelry on. He had a $200,000 car. He lives in a $3 million home. but he has no health care and no health care insurance. And I asked him, doesn't that sound weird to you? But then I found out from other friends who are in entertainment business, even professional athletes, they're riding around here in these $300,000-$400,000 cars, and not one of them have health care. Not one.
Mm-hmm. Yeah. And you know what? Okay, so there's a couple things to that, because I do get contacted from people in the entertainment industry, and there are places other than the US that they go to get their health sorted. So medical tourism was a huge issue, especially more private locations where there's anonymity and things like that. But with COVID, that's really put a dent in people's ability to freely travel, right?
Yeah.
So that's an issue. And the other thing is, in the States, the price of healthcare is so overly inflated. It's just, I mean, I think that it's a real risk not to have insurance in the States if something was to happen.
Right.
So many bankruptcies, and it's a real challenge to actually have. And I think that's part of why we're seeing such huge numbers of COVID cases in the countries where healthcare costs are out of reach. It makes it difficult for people to manage preventative healthcare, to go to the doctor just for a wellness check, just making sure I'm okay. Mm-hmm. Oh, wait, well, that means there's going to be a copay and I'm going to get a bill. So people don't necessarily invest that in themselves. What I would say to some of these entertainers is the company that you work for, where you have your contract, I would think that they would want to have amazing healthcare for you to protect their asset. Mm-hmm. Right? So.
Yeah, I think one of the things that we see sometimes, and is that I think, especially within certain communities and with the Black community, a lot of times as well, there is I don't want to say a fear of the medical system, and
it's a fear.
So like with what Randy's saying, people may be not paying attention to the health in that aspect, and not seeing it as something that's as important as having a car and having a roof over their head and jewelry and other stuff like that. In some cases, with some people not seeing the importance of, it's one thing that Randy's always advocated on, just people getting themselves checked regularly for different stuff, and just paying attention to your overall health, mental and physical.
And I think that that's a valid point. I think more and more what these last couple of years has shown us is that we have to be proactive with our health and advocate for ourselves. And, it's one of those things, if I'm going to look at the Black community in particular, and I'm going to speak just really freely about this, about what I see, okay? I see a community who, for so many years, has had so much stress. Mm-hmm. And has had to bite their tongue about so many issues, and force themselves to go through life knowing there is injustice and there's so much ignorance about it, and that takes a toll. Mm-hmm. So if you're looking at even physiologically, the muscle activation, okay, so follow me with this one, because I'm going to go on a tirade.
We're going to try. Okay.
When you have this muscle activation and of clenching, for example, I see it in cases where there's an unhappy marriage. Okay, let's say there's an unhappy marriage and there's abuse, and the woman has to bite her tongue so many times because she doesn't want to trigger her abusive husband, and she ends up with migraines, sleep problems,
right,
high blood pressure. Right, she ends up with all of those things. That literal, when you say bite your tongue, there's a literal actual clenching of your teeth that occurs.
Yeah.
Okay. So now take that and put that on a bigger scale with the Black community being in an abusive relationship with the white community. Okay. Having to bite their tongue, having to appease, having not to be too much because whatever, right? There is a muscle clenching that occurs. And when that happens, there's a disc. There's a disc behind your jaw, on each side. When you compress that disc stimulates your whole gastric system. It's responsible for your respiratory rate. That can give you sleep apnea, just that alone. And then you look at the inflammatory markers, okay? It's one of the most potent inflammatory markers that gets released into your system. So now you start to have all these inflammatory conditions. You get high blood pressure, arthritis, glaucoma. You start to get all of these issues, okay? So when people say stress, they're not really helping people to understand what exactly is happening in your body that is causing all of this impact. If you tell me it's stress, I'm going to tell you, I'm not stressed. I'm fine. I have a good life. I've got a good job. I've got a good house. I love my family. So there may not be that stress in your home, but there is that collective stress and pressure that's been put on people for years.
Okay.
Right? For years. And so now we just say, oh, it's common in the Black community for you to have high blood pressure. You're 60% more likely to have sleep apnea.
Peace, family. Don't forget to like, share, and subscribe, and check us out on AboutTheOnline.com. Don't forget to check us out on Facebook for exclusive playlists and social media for all different types of segments and content.